Erectile dysfunction is the inability to maintain or attain an erection suitable for sexual intercourse. That comes in different flavors for different people. An erection occurs when a man gets a stimulus either from their brain up top or physical stimulation that induces an erection. Your cavernosal artery inside of the penis dilates, blood pools in and stays in and gives that rigidity. When a man is finished to completion, a signal comes down from their brain, tells the penis to contract, leading to blood to pool out of the penis and for a man to become flaccid again. Erectile dysfunction is fairly common. More than 50% of men over 50 will suffer from ED. Because erectile dysfunction comes in different flavors for each person, many men will even suffer earlier, at younger ages. Erectile dysfunction is caused by a variety of different things. In order to have an erection suitable for intercourse, we need 4 things: good arterial flow, low venous outflow, good tissue elasticity, meaning the tissue expands and contracts, and good nerve function. So any issue that arises in any of these 4 things can lead to erectile dysfunction. Additionally, because the majority of erectile dysfunction is arterial, any condition that decreases the patency or the function of your arteries will lead to erectile dysfunction. Hypertension, diabetes, obesity, high cholesterol are all things that contribute to ED, as well as stress. Stress is also a large component leading to psychogenic ED, which we do see in a lot of younger patients or patients undergoing very stressful life situations. Erectile dysfunction can be diagnosed simply in a physical exam and interview. A patient can say, "I'm not having erections suitable for intercourse." They feel they're not lasting a long time. They go away quickly. "I'm having trouble getting them." And that's a very easy way to diagnose ED. In patients who have erectile dysfunction and let's say are being treated with oral therapies that don't work, then the next step would require a small injection into the penis and an ultrasound. The penile ultrasound allows us to understand the inner workings of the penis, the arteries, the veins, and to assess how your blood flow is, to essentially diagnose, why do I have ED? So erectile dysfunction can be prevented when it is caught early. Because erectile dysfunction is often arterial in nature, things that improve your arterial flow throughout your whole body will also improve your erections. Diet, exercise, sleep, stress management are all things that we can do to help prevent erectile dysfunction. Importantly, patients who are suffering from it, even when they're very young, should seek a provider to help them because, again, it is something common. The benefits of seeing a specialist for ED, such as myself, is to speak to someone who is knowledgeable, well-versed, and has experiences in the different types of erectile dysfunction. Of course, any provider can just give Viagra, Cialis, Levitra, or any of these medications. But beyond that, when erectile dysfunction becomes advanced, it's important to seek someone that has the ability to do an ultrasound, is comfortable with injection therapy, and ultimately, if those fail, someone who has experience, expertise, and training in implanted devices, such as the Coloplast. The psychological effects of ED are underrepresented or underreported, in my opinion, out in the medical literature. For men, erectile dysfunction is not an issue until it becomes one. Once a man suffers from ED, it is all they think about. Day and night is, my penis does not work. It plays a huge role in terms of anxiety. The anxiety causes a feedback loop to make the erectile function even more poor and leads to patients becoming more obsessed and frustrated, which leads to issues with marriages or relationships and also causes stress on their bodies as a whole. Additionally, ED is often caused by things that we as urologists do: radiation therapy for prostate cancer, removal of the prostate for prostate cancer, or a variety of other surgeries or procedures that are done. And on top of being diagnosed with cancer or other issues like that, to have erectile dysfunction on top of it is a huge psychological blow. The important thing about that is that there are options, right? And although maybe it's a different way of getting an erection, it's still possible. So it's super important. whenever you're thinking about seeing someone, go have a conversation, see what's out there, because there are a lot of ways to get you back to where you were, and you're not alone.